framing all of this discussion in a public health terms, because really I think that's the target, that if you're a Ministry of Health and you're trying to serve your population, then you need to do something to leverage what you have, which is some mammogram machines and some radiologists to treat all people. So how do you do that? You have to narrow that down. Just to give you an example, I mentioned there's like 360,000 studies in women done. The positive rate, the number of times it shows something, is under 10%. So if we just take 10% as the number of positives, and positive doesn't mean cancer, it means lumps. And it just means that's a high-risk woman. If we just take that 10%, we take your 9 million women, we get it down to 900,000, again, this is a solvable problem that, your government, if it's all done through public health, or your private hospitals, just to find the cancers and treat the cancers, they can take it on. And so I think this is a really good approach. Again, the World Health Organization doesn't like us using the term screener. It is really a pre-screener or triage device because it's, again, not definitive, but it helps you identify risk.
Sure. And from that perspective itself, you're looking at it for population. Now, you're a breast surgeon. And obviously most of the cases you see and probably operate on stage 3, stage 4, but
stage 0 to 3.
0 to 3. Okay, 0 to 3. But you find that that if someone had done some pre-screening and they'd known about this, it obviously helps them survive this better, right?
In general, that's a good generalization, and I think as a public health message, that's correct. There's definitely cancers out there, breast cancers, that show up, whether you're screening or not, as a palpable lump, and they're already stage 3 or 4. Biologically, not all breast cancers are the same. But if you're treating a population and the majority of cancers are going to follow this pattern, then if you can treat them in stage 1, that's easier than 3. And always easier than 4. And so finding that, in a population, finding more of those cancers early is going to improve the health of your, government's expenditures on healthcare. So,
and in the time that you've been, aware of this product, and obviously from 2004, and you've seen it expand and get better, what's your point of view of these kind of handheld devices as a pre-screener?
Again, in the United States, we don't have a lot of experience with it as a pre-screener because we have a pretty robust screening
program with mammogram.
But I'm working with this particular company over this long period of time in all kinds of settings. Malaysia, one of them, but actually in India, a lot more expanded use, especially in governments. It is working to identify women who have breast cancer that were previously either never going to be screened or only going to show up when it was a big problem. So it is working in these, demonstration projects that we've done in all kinds of settings globally.
And